Hello, today is the 17th of April 2020. I was just looking at myself on the webcam here. I remember when I had hair here and here. That was, yeah, okay. Anyway, did a little more digging on some things. Let's go ahead and talk about the numbers for today. 692,000 infected in America, and the death rate is now at 36,700. Yeah, I keep hearing these reports that the curve is flattening, it's kind of going down, and so there's this other map that I looked at, and this is from, again, I've been getting my data from a source called the Guardian, but it's been the same, and they're supposedly getting it from the John Hopkins, Okay, well, there's another source also that cites John Hopkins University as their source of information, and it shows like the rolling 7-day average of whatever. And if we look at the curve there, then it actually shows that the curve is starting to go down slightly, but it's misleading a little bit because there was a couple of days when it really went down and then went back up again. So it's not like we're having straight up, then straight down. It's like, so when you look at the average, it's kind of, so we still have quite a few new cases on a daily basis. When you're getting 30,000 new cases a day, 30,000 a day, okay? But it's averaging that. So it's not like jumping up to 40,000 or 45,000 or whatever. So the numbers continue to skyrocket, but the number of new cases seems to be kind of leveling out, which is what they were looking for, which is why there's been so much chatter about when can we reopen. Well, again, we don't want to pull the trigger too soon because then it's a thing. And also in the news from locally is that Durham, which is not far from where I live, Durham's in a different county, but it's just north of us. They're requiring masks in public. So if you go out in public, you're required to wear a mask. They have not done that for Wake County, where I live. And yeah, so there's the thing. Another bit of news is that there was some kind of bickering going back and forth between the president and the governors about who's going to have say of when they're going to be able to open different parts, and the states saying, hey, we have the right to make this decision. Some states are even getting together, forming a coalition saying, hey, as this group of states, based on where we are in America, we're not really hit super hard, as opposed to a super highly populated area like California or New York or Florida. So basically, the news today is that the president has kind of backed off and said, you know what, fine, go ahead, do your thing. You have to do the testing, though. That's kind of the caveat. If you're going to do your own thing, then you're going to be responsible for it. A lot of, back and forth pushing on stuff like that, which kind of just is not real fun. More news again about how so the more data on who's been affected the most, and the two things I've seen recently, that more men are dying from this than women. They don't believe it's anything to do with genetics. They believe it has everything to do with people who smoke. And generally, older men tend to be heavier smokers than women, apparently. That's the correlation they're trying to find. Because if you're smoking, then it's a respiratory thing, and this kind of impacts the respiratory system. And there's a disproportionate amount of black people, those who are, identify as black or brown, that more black people are dying than any other demographic or race or ethnicity or whatever you want to call it. And again, the reason being it's not a genetic disposition. It's not like there's something about, the pigment of their skin, which has allowed them to be more susceptible from what they can tell. It's more, again, a reflection of access to healthcare and access to getting tested. And one study even said that it's even just access to general education, that, people just aren't paying attention. They don't, they're not watching the news. They're not following the rules. And again, that is not social commentary about any one group of people in general, just like saying all men are smokers. You're not saying that all black people are uneducated. That's not what I'm saying. I'm saying what these reports have said. Also, the fact that in New York, where a lot of the deaths are happened, there's a lot of people who are packed together, and it's generally black people who have been, that live in a very highly concentrated area of where people live. So that's part of it. It's, what I fear that's going to come out of this is how before COVID-19 started, there was already a lot of racial tensions in America. And once this kind of clears out, I don't want this to be the fuel that kind of restarts that, which unfortunately I kind of feel like it may be something that we're going to hear about. I'll bet in a year or two I'm going to have students write papers about how COVID-19 was more black people, and that's and have any number of reasons behind it. But the most valid reasons that I've seen is just lack of adequate health care, which we know is a problem in America, and the fact that these sources are coming from where there's a dense population of people that are living in a very close area. And it just so happens that these are like boroughs in New York and stuff that where a lot of black people have been living. Okay, so that seems to be the most contributing factors that make sense, because those are already social issues that we've already had in place. And the fact that more black people are dying is more of a reflection of the problems that were already there, as opposed to, other issues, problems that should be and have been being worked on, but obviously we have a lot more work to do on that. So anyway, that's the update for the 17th of April, 2020.